Hi. Palpitations are something which can affect patients in various ways. Palpitations really mean an awareness of your own heartbeat. And what I'm going to talk to you today is about the causes that can come from the heart in terms of palpitations, and also some of the investigations and treatments that can be done. As I said, palpitations purely mean that you're aware of your own heartbeat. It's the job of your cardiologist to then define whether or not this is related to a problem with the electrical activity of the heart, and could be slightly more serious, or whether it's a variant of normal. We all get palpitations from time to time. In terms of the investigations that your cardiologist would want to do, an ECG is important because sometimes you can see things on the ECG that are relevant to palpitations. An echocardiogram is sometimes quite useful because this will show that the structure of the heart is normal or abnormal. There are ways of monitoring heart rhythm for longer periods of time, such as a 24-hour tape or even a 7-day monitor. And in some patients, we can even think about doing longer monitoring for a period of up to 18 months with something called a reveal device. Your cardiologist is going to want to ask you a couple of questions. To ask, when you get the palpitations, how often you've had them, when did they first start, and to look at other things like if you have a family history, and also to see if there's any other associated features that you get, such as chest pain or dizziness in particular. In terms of the treatment of palpitations, there are things that can be done. Sometimes you don't need anything, and that's certainly a treatment strategy, not to do anything and to look at an underlying cause. The second thing is to think about other things such as treatment with tablets. And in some patients, they require further treatment with more invasive strategies such as ablation, which involves putting catheters inside the heart. So really, it's important to do a joint decision between you and your cardiologist as to what to do for the future for your particular palpitations, and to define actually whether they're serious or not.